Auzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Welcome to everybody to our medical study session, part 2 medicine. Um, Dr. Sarika, she is going to explain the whole process from where we need to start, begin the process. I would like to welcome Sarika, and we have also Farzin Ahmed. She's the program coordinator. She's going to start the program. So, Auzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Welcome to everybody.
Okay. Do we think we're ready to start, or do I need to wait a few more minutes?
Hey, sorry for the technical difficulties. Yes, Farzin, can you introduce Sarika and maybe you can run the session?
My name's Breezy and I'll be today's moderator. And if there's any questions, I'll be asking you. And yeah, yes, sir. Okay, perfect. So Assalamu alaikum, everyone. My name is Sharika. I'll just be chatting with you guys today about what my journey into medicine looked like and what sort of one of the general, sort of one of the traditional routes to medicine looks like. Please note that there's many, many different ways that someone can enter medical school and how someone can enter this career. So what I'm sharing today is not the only way to do it, but this is just my experience. And yeah, thank you so much for taking the time today, out of your long weekend to come and join this. Okay, so and can everyone hear me properly? Yeah, okay. Okay, perfect. So a little bit about myself. I went to high school in at Pearson, so um, nothing fancy, just my local high school. I did do the IB program and I was part of the French immersion program as well, but by no means are those like necessary to get into medical school. I have lots of friends who just did the regular high school program, and that was totally fine for them as well. So if there's anyone here in junior high that wants to chat further about, IB or French immersion, then we can chat about that later. For my undergrad, I went to the University of Calgary and I did biological sciences. You'll see this among a lot of medical students that they'll have biology, kinesiology, psychology as their undergrad degree, but we'll chat about how other degrees are also feasible. And there's not a single degree that's right for you if you want to do medicine. For medical school, I went to the University of Calgary as well. So the U of C Med School program is 3 years. So I graduated very recently, actually graduated last year, and then now I'm training to be a specialist in obstetrics and gynecology for about 1 year now. And outside of sort of my education and career, I really like spending time with my friends and families. I enjoy watching movies. I do lots of ice skating. That's sort of how I de-stress. I like going to karaoke with my friends. Traveling when I'm able to do so and when I have time is nice to be, able to do it. I recently did a trip to France and London with my friends, and that was very nice. And then, I mean, we're so fortunate just being near the mountains all the time in Alberta. So it's also nice when you don't have a whole lot of time, you're able to just hop away there as well. I just see lots of people in the waiting room, so I'm just gonna let them in before we continue. Okay, perfect. So this is a little agenda and overview of today's session. So I'm going to start off chatting about a lot of you have actually sent in questions about how long does medical school take? How long does it take to become a doctor? What is the general path to becoming a doctor in Calgary? So we'll chat about an overall timeline. Then I'll chat about sort of some things you can do in high school, some things you can do in undergrad if you're interested in sort of a career in medicine. And then I'll chat about applying to medical school. That'll be sort of a big chunk of today's session. And then about medical school itself. So bear with me, and if you have any questions throughout, then you can either put up your hand or throw it in the chat, and Farzine has kindly volunteered to moderate that for us. Okay, any questions so far? I'm going to take that as a no. So, as an overview, medical school. So, the journey is very long. So, you start with high school, right? You'll all do your 3 years of high school, graduate, and you require an undergraduate degree. So, this is a bachelor's degree. Now, this bachelor's degree is usually 4 to 5 years for most people. But what a lot of people don't know is that you don't have to complete your bachelor's degree to get into medical school. You can apply after your second or third year. It's very different rules for every school in Canada. So you want to make sure that you're taking a look at every requirement. But as far as I'm aware, you can apply approximately after your third year. I did finish my bachelor's degree, so I did the full 4 years and then I applied. Usually, sometime during your bachelor's degree or after that degree, people will write the MCAT. That's the medical college admission test. So, this is a very, very long exam. I want to say it used to be 7 hours. I think it's maybe 5 to 6 hours now, where you're tested on 4 core subjects. So, there's biology, chemistry, there's physics and math, like reading comprehension, and then there's one more. I think it's sociology and psychology. So those are sort of the four main overarching subjects that you're tested on. And we'll talk more about that. The MCAT is sort of an exam that you need to take to be able to apply to medical school, but your score itself is not that important for medical school. It's important, but it's only worth a very small portion of your overall score. Okay, so after you've written your MCAT, you've either done part of your undergrad or all of your undergrad, then now you apply to medical school. This application is very, very extensive and we'll chat about it. After that, once you are accepted to medical school itself takes about 3 to 4 years. So Calgary, the University of Calgary and the University of McMaster have 3-year programs, whereas every other medical school in Canada is a 4-year program. Now, once you're done medical school, great, you are a doctor. After this, you might want to specialize into something specific. For example, for me, I chose obstetrics and gynecology, and that is a residency program. So, this is you as a doctor training to be a specialist or a generalist. If you choose to be a family physician, that's only a 2-year training after medical school. Whereas if you choose to be any other kind of specialist, it's generally 5 years of training. Okay, so based on this graph, I know this is the first image is what it looks like. It looks like it's very linear, but it's not, right? You may need to write the MCAT once or twice. You may have hurdles along the way, right? Lots of people do their masters before they go to medical school, do a PhD before they go to medical school. And that can be for various reasons. They can feel like this is something they want. This is a qualification that they want under their belt. It can be something you're doing as you're applying to medical school, like parallel planning different careers. Medical school can also be an afterthought, right? I have many people in my class who became engineers, they became lawyers, and then they later realized, I want to go to medical school. So they left that career and they came back and they applied. So their timeline is not going to look like my timeline that I have right here because they're going to have more loops and more hoops to jump through at that point. So just keep that in mind that it's not a direct path. There can be many different things in your way, and it can also be an afterthought. It doesn't have to be the only career that you're thinking about at this time. So, chatting about high school. In high school, you don't have any specific course requirements that you have to take to get into medical school. Medical school does not look at your high school marks. What high school is important for is to get into undergrad, and an undergrad is necessary for medical school. So, a lot of people have asked, what sort of courses do I need to take in high school? Just take whatever is relevant to the undergraduate degree that you're applying to. So if you are applying towards biology, if you're applying to the sciences, then take the sciences in high school, right? If you're applying to engineering, then you might not need biology. I will say though that taking biology, it helps you during the MCAT, even if it's just high school biology that you've taken, a lot of that base knowledge that you've sort of built upon is helpful and useful when you're writing the MCAT. And what's most important, I think, in high school to do, other than sort of like grades and the courses you've taken, is actually building soft skills. So build your communication skills, work on your time management, work on working in groups and working in teams. And the way you can do that is by getting engaged and involved in your community, right? You can volunteer. I find that volunteering has helped me build so many skills, including public speaking, managing your time. You can join sports teams to help you work on collaboration. So do things outside of just your classes to just help you become sort of the person you'd like to see, like sort of the qualities you'd like to see in the doctor that you have. Okay. Next, for undergrad, at the University of Calgary Medical School, there's no specific undergrad that you have to take. You don't have to take biology, you don't have to take psychology. So you just pick a degree that interests you. Now, the catch is if you do apply to other medical schools, which most people will end up applying to a few different schools, then they might have different requirements. A lot of medical schools do require a certain number of science classes, a certain number of English classes. So, for example, if you study a degree in biology, then it'll just be part of your, you'll just already like automatically check off the requirements that you need in order to apply to those schools. If you do engineering as your undergraduate study, then you might not have sort of the English classes, the biology classes that some of the schools require you to have. But just note that the University of Calgary doesn't have any specific course requirements as of now. So just pick a degree that interests you and that you can see yourself pursuing. And like I chatted about before, some traditional degrees that people usually have done before medical school include biology, kinesiology, the health sciences, psychology, but by no means is that necessary. You can also do engineering, business, law. I had a girl in my class who did, they did their undergrad, they got into law school, they did a full degree in law and also worked as a lawyer, and then came back and thought, hey, actually, I want to do medicine. And then they sort of shifted paths and applied to medical school. So there's no like standard course of things that you must do. Now, regardless of the degree that you pick, try to maintain a high GPA. If you are in junior high and high school and you're attending this session, you might not know a lot about the GPA system, but essentially it's a mark out of 4, and you want to be as close to it as possible. And in undergrad as well, outside of your academics, involve yourself in volunteering and clubs and extracurricular roles. Involve yourself in research if that's something you enjoy. I wouldn't say there's anything that you need to do as a key to get into medical school, but do
Yeah.
these things if you enjoy doing
Anyone
those.
want to listen to this?
Sorry, is there a question?
I started.
Okay. Okay, yeah, so there's nothing that you have to do to get into medical school, but if you enjoy doing these things already, then I would encourage you to build your skills and build upon them. And then to chat a little bit about myself. So some of the volunteer work that I did, something very, very standard is I volunteered at the hospital. You'll see many, many people who are interested in medicine volunteering at the hospital. By no means is it a requirement, but I enjoyed doing it. And you'll notice that there's different roles that you can do in the hospital. And I did something called the No One Dies Alone program. And this is people who are passing away without families and they just needed someone or they wanted someone to provide support to them during their last sort of moments. So if you're interested, that is something that's available. I think you have to be 18 to be able to do that just because it just requires a level of maturity. You can get involved in different clubs. I'm Bengali. I was involved in like the Bengali Student Society. I had an executive role in that club. I was involved with like UNICEF and I was involved with We. So just things that you're already interested in, try to take on leadership roles in that club. For example, there is a club called Humans of New Calgary, and I don't know if you guys are aware of Humans of New York, but it's very similar where it's a photojournalism club where you take a picture of a person and you chat with them and you sort of talk about their story. So I was an executive member of that club and I enjoy photography, so that was a good way for me to sort of stick to my hobbies, but at the same time be something that is sort of polishing your resume and prepping you for medical school as well. And lastly, research. Research, if you hate research and you don't like doing research, that's okay. You don't have to do research. But you can always find a topic that you're interested in. It can be something that your professors have sort of mentioned in class. It can be something related to your academics. It can be something not related to your academics. My research dealt with a lot of barriers to healthcare access that the Bangladeshi community was sort of going through, or immigrants in Canada were going through. And that wasn't necessarily related to my health sciences degree, but it was just something that I was also interested in. So research is a good way for you to actually look into things that are not totally a part of your degree, but that interest you. And then if anyone has specific questions about finding research opportunities, we can chat about that in the Q&A session afterwards as well. And then this is sort of the million-dollar question. What if I study biology or health sciences and then I don't get into medical school? What happens then? Don't worry, it's not the end of the world. We often think that biology, the only thing you can do with it is apply to medical school afterwards, but that's not true. There are a vast amount of careers in healthcare, right? There's physiotherapy, there's dental school, there's so many different things that while you're doing your undergraduate degree, you might realize that, hey, I'm actually more interested in this. Or maybe the medical field is the only thing you've been exposed to, but through university, you'll expose yourself to optometry and all these other careers that are actually available to you. There's public health. You can also just do research in that field by doing a master's and PhD in biology or whatever your undergraduate degree is. So it's never the end of the world, and you've never hit like a dead end if you didn't get into med school your first time. And it's actually quite normal to apply a few times. Now, the application to medical school is very extensive. There's a few different things that we need to chat about. Most people only talk about the MCAT. And while the MCAT is important, there's so many other things that goes into this portfolio. So the minimum GPA that you need to have to apply to medical school is 3.2. I want to say that comes down to like a B plus. So you need to be able to maintain a B plus or a B approximately to just be able to apply to medical school. Usually people say just having a 3.2 isn't enough. You want to have a higher number, but if you want to be able to apply, 3.2 is good enough just to throw in your application. But obviously, the higher your GPA, the better. I myself did not have a 4.0 GPA, so I will make that clear. Course requirements for the University of Calgary, like I chatted, there are no course requirements. There's no specific class that you need to take to apply to medical school. The University of Alberta does have course requirements, and most of the other universities do have course requirements. Your MCAT, the score on your MCAT is approximately 10% of your overall medical school application score. So it's a very small percentage. Of course, you want to do well wherever you can do well. You want to earn points wherever you can. But that said, if you didn't do very well on the MCAT, it's not the end of the world. It's worth very, very little. Something that I think a lot of people don't focus on, but we really need to focus on in Calgary is you write about your top 10 experiences. Now, this can be an experience in life, it can be volunteer experiences, it can be extracurricular experiences, but you chat about sort of the things that where you were able to make an impact somewhere. These would generally be your top 10 experiences or big experiences that changed you. These sort of allow the medical school application committee to determine what kind of communication skills you have, how you're able to get along in a team, sort of what you've gone through in life. Next, research and publications are important. And remember, it's never necessary. There's no, if this person didn't do research, then they can't get into medical school. It's not like that. But every little bit helps. So doing research is great, but if you're able to get your name on a publication, that's even better. To say, hey, I was the author. It doesn't have to be the primary author, but hey, I helped author this paper. That would make your application quite strong. You also need 3 references when you get into medical school. These can be sort of people who have supervised you in volunteer roles. It can be your professors. It can be research, research supervisors, but they will touch on three aspects. So someone will chat about your communication skills, someone will talk about your organizational and sort of time management skills, and someone else will talk about your collaboration skills. So these are the three components that medical school is really looking at, is if you're able to work well with others and if you're just a pleasant person to work with. And then lastly, this is also very important, if your application is screened and you sort of make the cutoff, then you are sent an offer for an interview. At this point, the interview is worth 50% of your score and your written application is 50% of your score. So together that determines your total application mark, and that's when you're able to see whether or not you got an offer to actually join the medical school class. The medical school interview is very interesting. It's not like a hi, tell me about yourself, who are you kind of interview. It's called a multiple mini interviews. What that means is you knock on about 10 sets of doors. So you knock on 10 doors, you go from one door to the next, and they ask you sort of ethical questions. They might ask you various different questions, like, you're driving to Banff. You see someone, stuck in the middle of the hallway or the highway, and you only have I don't know, you only have two ski poles in your bag. Like, how do you help this person? Or what do you do? It's sort of thought-based questions like that that allow you to think critically, and they're able to sort of see how you're thinking, but they're not really like direct questions that ask you about yourself. So that's what the interview is like. And at the end of the interview, you're given a score. So that score and your written application score merge together to give you your final score. I hope that makes sense. I know that was a lot, but I'm happy to take questions after if that didn't make sense to anyone. And then, so what is the secret to getting into medical school? You definitely need good grades and you need to do all the things that you hear about. You need to do well on the MCAT, but at the end of the day, it comes down to time management. So you have to be someone who's very well-rounded, and to be well-rounded and to be able to sort of immerse yourself in all these different roles outside of just your marks, you need to be good at managing your time, because you don't want either ends of the spectrum. You don't want someone with a 4.0 GPA who only focuses on academics, but you also don't want someone who, does so much for their community, but doesn't have enough of a high of a GPA to apply to medical school. So you really need to strike a good balance, and that can be really difficult. You need to be good at communicating. You need to be able to communicate your priorities to the people who work around you. You need to communicate your priorities to your friends and your families. It's really, really important. And you need to be resilient. It's very, very common to not get into medical school the first time you apply. Extremely common. In fact, most people do not get in the first time they apply, but you just have to be willing to get back up and throw in the application again, try to see where you can improve and just see how you're able to improve yourself, your application, ask friends and family, and that way you're able to just do the process again. But it can be a tiring process if you're sort of not dedicated to this profession. So that's really important. I have a friend in my class who applied to medical school 7 times. She applied the first time during her undergrad, didn't get in. Then she applied again at the end of undergrad, and she didn't get in. So she decided to take on a master's. Her master's was 3 years, so she applied every year of her master's, and it didn't work out. And then she decided to do a PhD, and she applied throughout her PhD, and eventually, alhamdulillah, it worked out. Now, I'm not saying that all of you will take 7 tries to get into medical school, but you just need to have that sort of perseverance to keep going if this is something that you're passionate about. Okay. I think for most people, if they've applied 3 times, it's very easy to be tired and burnt out. And it's very easy to say, I'm not going to apply anymore. So it's just important to keep that in mind. And then let's say medical school. Medical school is a lot of work, but it's a lot of fun. I personally found it more enjoyable than my bachelor's because now I wasn't taking a series of classes where I had to get this 4.0, I had to get this A so that I could get into medical school. There's a lot of heavy pressure that's lifted off of you once you enter medical school. And now, you might like biology and that's why you took biological sciences, but you're not going to enjoy every single class, right? Or biology will still ask you to take physics and math as some of your prereqs, and you might not enjoy that. But finally, in medical school, I felt like I enjoyed the classes that I took. I enjoyed the subjects that I was learning, and I got to do it with friends. I made lots and lots of friends and like lifelong friendships. The way med school sort of works is the first half of medical school is pre-clerkship. Now, this is in-class learning, right? Just like you do in university. The professor is sort of teaching you a certain topic. It might be different systems, the cardiovascular system, the GI system, and you're learning about them and you're doing testing. You're going to the anatomy lab, you're learning anatomy, and you're getting tested. And then the second half of medical school, you are an intern. So you're going through different rotations in the hospitals. You're rotating through like general surgery and internal medicine and family medicine. And you're sort of putting in your time and you're putting in the work to help out in that role. This last year of medical school is sort of allowing you to experience different fields within medicine, and it allows you to choose a specialization at the end of the day. So you're able to see, hey, do I like surgery? Do I not like surgery? Do I like clinic medicine or do I like hospital medicine? So it's good being immersed sort of right there in the scene, and you're able to sort of figure out what kind of medicine is best for you. At the end of medical school, you apply to residency, and that's where sort of you pick, after I'm a doctor, what kind of specialist do I want to be? And you work on that. So that's sort of a general overview. Do you guys have any questions at all? I know I went through a lot, but I tried to go through sort of the things you can do in high school, in undergrad, and applying to medical school, and then what medical school is really like. But let me know if you guys have any questions at all.
Yeah, I have a question. Like, how did you prepare yourself, like, for the interview? Say.
So, yeah, preparing for the interview is really tough because part of you doesn't want to prepare for the interview until you know that you have an interview, right? You don't want to put in work towards something until you know that you're actually going to need to do it. So once I found out that I got an interview, what I did is there's lots of lists of like old interview questions online, and you're able to just practice. I just practiced with friends and family, and we sort of just like quizzed each other and saw what sounded good and what didn't sound great. And that's sort of how I did it. There are like MMI practice sessions, I want to say, where you can like pay and do those sessions. I just wasn't exposed to those, so I didn't do them, but I've heard from other people that those can be good as well. And you'll see lots of like sort of MMI practice sessions thrown out by like the MSA at the university or by just the medical school itself or different community organizations, and you're able to practice with them as well.
I also have another question. Like, you know how a lot of people like apply to medicine school? Like, I understand like programs help you stand out, but is there anything else like that can like make like medicine schools like select you? Because I know like the administration team from like the medicine school like they change every year though, right?
What do you mean, like help you stand out as an applicant?
Yeah.
It's really hard to say, what exactly makes someone stand out, but the way you write your application, when people are able to see that you're passionate about the things that you're doing, I think that helps you stand out. If you're just sort of treating your application to medical school as like a checklist items of things you have to do because you've heard you need lots of volunteering and you need research, then that can come through. It can show that this person is not really passionate or not really interested in this, and that can show in your written application. And I think when you're writing, being able to write like what sort of impact you're making through this role, through this research, or through this volunteer role, I think that helps you stand out.
Okay, so this is like a question from the chat. It's do you know any links or websites to apply for volunteering at a hospital, or do you have to personally contact the hospital?
No, you don't need to personally contact the hospital, but if you write like, I don't know, like Alberta Health Services volunteer, I'm sure there'll be like a link that pops up. I don't have any like on hand, but there should be a standard link that you're able to click on.
Oh yeah, here's another one. How would you prepare for the Casper? Like, you know, the for your personality test, I'm pretty sure it's.
Yeah, totally. So, yes, some medical schools require Casper, which is which is essentially like it's sort of like situation-based questions like the interview that I was chatting about, but it's typed. And so you have to type very fast because you only get 5 minutes to answer like a series of three questions. So you type very fast, practice your typing. And then there's also sort of oral questions that you can answer. Like some of them might be like a video that pops up on the screen and you'll see, I don't know, like two friends like fighting about something, and they'll ask you like, what would you say to this person? And
Oh,
then
so
it'll just start recording you.
so would you say it's like similar to the interviews?
It is kind of similar to the interviews, but whereas the interviews, you want to be able to pour more detail into your answer, the Casper is hard to do that with just a few minutes to answer each question. Yeah.
Okay, here's another question. It's like, what's the daily life of a medical student and after residency?
Yeah, totally. So the daily life of a medical student, if you're in the first 1.5 years before starting sort of your clinical rotations, then it's very like usually like 8 to 4, 8 to 5, like regular school. I guess that's a little longer than regular school actually, but you go to lectures and you just listen to your lectures and you do your classes. There's also things called small groups. So you'll be in groups of maybe like 15 to 20 people and you'll be able to discuss cases with a doctor that's able to help you run through those cases. So it can be, if you're studying about the liver, then it can be a person with hepatitis and you're learning about it and you're sort of just going through the scenario. That's what small group is like. And then otherwise, you're just doing your lectures and classes just like you would in university. After that 1.5 years, you do your clinical rotations, and at that point, you're sort of split up. So you're not like seeing your friends every day anymore because everyone's sort of at a different hospital on a different unit. So let's say you're doing family medicine, then you would show up to this family doctor's clinic and you would be the one like taking patient history and doing the exam. And you tell the family doctor, like, hey, I think this person has a knee injury, and I think this is what the injury is. And the doctor will tell you whether or not they think that's appropriate or not. And you guys can chat about whether you think like an x-ray, an ultrasound, or what the next testing is required. And I think that's a really, really good way to learn about the different things is by seeing them actually out in the community. So
Would you say
that's,
like your
yeah,
SAT or ACT marks would like matter to get into medicine?
SAT.
Yeah.
In Canada, we don't do the SATs.
Okay.
So yeah, so I'm not sure how that would apply, but I don't know. If someone was coming from an American school, they would have to do the SATs. But yeah, we don't do them in Canada.
Okay,
And
here's another question in the chat is like, do you have any reading or book suggestions to prepare for the car section and Casper?
yeah, so the books that I applied to reading, the book that I read when I was applying and trying to prepare for cars is just I had the Kaplan set of MCAT books. And so I just did the cars sort of questions from in there. Any reading comprehension is really, honestly, it's good. Cars is really difficult because at least for me, I felt like every answer that you could pick sounded like the right answer because it was just written in a way where everything sounds right. But the only way I think to really get good at it is just to practice yourselves. And I think the best practice is probably just from the AAMC website that has lists of like old MCAT tests. You're able to do those specifically, like those car sections. Those will be most relevant to what your test will look like.
All right. Also, another question is, what's the best way to write about your experiences and how you think you'll impact society in your essay? For example, what kind of prose or structure do universities prefer?
What kind of what do universities prefer? Sorry.
Prose or structure.
Mm, that's hard to say. That's a good question. I don't know. It's hard. When you're talking about your experience, it'll come through as to whether or not you're passionate about that experience. There's not a specific like rule or structure that you have to follow. Lots of people like the STAR method, which is like situation, task, action, and then I don't remember what the R even stood for. I don't remember what R was for, but let me know in the comments or in the chat if you guys remember. But the STAR method is something that's used very commonly.
Okay, Sarika.
Mhm.
And one question is I see that three reference, right? You need to keep. So people are students. I think there are some students are getting ready to apply. So sometimes they're confused. They have lots of reference, right? 5, 10. So they have to choose three. So which reference should they choose from their school or university or community or volunteer organization? Please.
Yeah, I would pick references that know you best. They don't have to be like big hotshot doctors with lots like a big name in the community. It doesn't have to be like that. Just whoever knows you best and can speak to the things that you've done. I think that's really important. Monir Uncle was one of my references. Well, actually, Kanye Zanti was one of my references in terms of sort of the community work that I did. And that was really helpful. And then the other references that I used were one was my professor who knew me from a smaller class. For me, because I did biology, my classes were really, really big, like 300, 400 people per class. When that happens, it's hard for the professor to really get to know you. But when I was in third year, I had smaller classes. I had a class with like 30 people, and I got to know that professor really well. And so she wrote my reference. And then the last reference that I used was for my research supervisor because we worked one-on-one very often. So I used one from the community. I used one was my professor and one from research. And I tried to lay it out like that because I felt like that covered different aspects of who I was. But, if you're close to three professors, that's okay. There's no specific rule as to who needs to write your reference.
Thank you.
Mhm.
Yeah, I think
There's
that's.
another question maybe about the reference related. Can you see, Farzin?
Oh yeah, it's can references be personal teachers and mentors? Like for example, your art instructor? That's the question. That's
Um, it can be when they're more personal, like someone that you didn't work under. Like, your references can't be family members. They can't be, my mom thinks I'm really great and she's gonna write me a reference. It can't be like that. And so it should be a professional
Even
role.
if she's teacher or maybe daycare
Yeah.
director or anything, but you family member cannot be, right?
Yeah, not a family member. Even if your family member is your teacher, they can't write you
Okay,
a reference.
okay.
But anyone in a professional role, like I think you mentioned your art teacher, that's still a teacher. So to me, that still sounds fine. But when you're applying, you can always send a message to the admissions committee just to clarify, just to make sure at the end of the day that it's an okay reference. And then I think there was a question earlier as to what your day-to-day looks like as a resident doctor. So I am happy to chat on that, touch on that. So that sort of depends on what specialty you've chosen. For me, in obstetrics and gynecology, what day-to-day looks like is I'll show up around 8 a.m. We all meet around this whiteboard that shows which of our patients are in labor. So if you guys don't know, obstetrics and gynecology deals with pregnant patients. We deal with female reproductive health, and that's sort of the bulk of our patient population. So we show up at 8 a.m., we meet, we get handover from the team that was on overnight. So they tell me, this patient's already delivered, or hey, this patient still has some ways to go. You guys will have to take care of her going forward. So we do that handover. Then I go meet all the patients who are in labor. Then it's time for sort of our scheduled C-sections of the day, right? So lots of people need surgery to have babies. So we go and try to do those surgeries early in the morning. Within that time, we try to see, hey, this person is also close to delivery, so maybe we shouldn't do this next surgery yet. We try to stagger things so that we're able to attend each delivery, of course. So there's a lot of vaginal deliveries and C-sections that happen throughout the day. There will also be gynae cases from the emergency. So the emergency doctors will call us and say, hey, there's a patient with this going on, and I think it's related to gynecology, and I'm not too sure what to do about them. So we will take on those patients and we'll figure out what to do for them. And then the day will end at 5 p.m. after sort of we're done delivering babies or doing C-sections or seeing these gynae patients. We end at 5 p.m. and I'll hand over to the night team. What that means is once in a while, I'm the night team, which means that will be a 24-hour shift. If you're on day and night, then that's a 24-hour shift, but we don't do them that often, usually once or twice a week or so. If you're doing a 24-hour shift, then you don't come to work the next day because you worked really hard, so you get the next day off. So generally 8 to 5, and then when you're on call, then you're on for 24 hours. And the night, if you're on during the night, it sort of looks the same way. You might have emergency C-sections, lots of babies being born, and then lots of pregnant people who need your help. So that's what it looks for me as a resident in gynecology. If you were to ask my friend in psychiatry, that would look very, very different, right? They would deal with mental health. And my friends in internal medicine, they'll deal with like heart failure and liver failure and things like that. So it's very catered to the specialization that you've chosen.
Another person asked, how easy it is to match with your preferred specialty after you completed med school.
Yeah, so the match is a huge topic, and that can even be like a topic on its own. The match it's hard. Alhamdulillah, I matched my first choice. I wanted to do gynecology and I wanted to stay in Calgary. That was important to me. But you're never guaranteed. So you rank a whole list. You might rank, 10 different places. Like, hey, I want to do gynecology in Calgary. If not, I want to do Edmonton. If not, I want to do BC. And you want to be able to rank a bunch of different places you'd be willing to go to. Before that comes interviews and applications, almost like applying to medical school, but for a different thing. And now you're applying with a group of medical students. So for the match, you're putting in another application again to say, hey, I want to do this specialty. This is why I want to do it. These are the references that'll speak to how I would do well in this specialty. And this is sort of the clinical work that I've done to help myself in this specialty. Then after that application is taken in, then at that point you get interview offers, just like applying to medical school. And then you have to go through those interviews once again. And that's how you match to sort of your desired specialty. You might be interested in a few different specialties or a few different locations. Most people match to their top 3 choices.
Did you also have to like apply to CARMS?
Yeah, ARMS is the residency match. So that's in your last year of medical school.
Was there like a process you had to do to apply?
Yeah, so the process is writing like your written application as to like why you want to do that specialty. You do exams again. I had to do the Casper again, and then there's a few different tests, and then you do your interviews, and then yeah, you rank your specializations. But I think I'm just looking through, and I think everyone here is still sort of far from that. So I'd focus
Yeah.
on getting into medical school first, and then CARMS will happen when it happens, and everyone will be in it together. You and all your classmates in medical school will go through it. So it's a very supported process. I felt like whenever I was lost, my medical school professors and the doctors were very helpful at letting me know, hey, like this is your next step. So I wouldn't worry about CARMS right now.
Another question is like on in the chat, it's how stressful are night shifts? How do you balance priorities regarding the community and yourself?
Yeah, night shifts can be stressful. Personally, I feel fine doing them. If you feel like you're someone who can't do nights, then there's specialties that don't do nights, right? Like your family doctor is not working during the night, so you can pick specialty like that. Um, there's outpatient specialists, so people who only work in clinics. They don't work during the night, but during your residency training, essentially everyone has to work nights. It can be stressful because you're the only resident doctor on for that specialty. So there's a lot of pressure on you. There's a lot of responsibility, excuse me. Um, but I don't know. It varies person to person. For me, it doesn't really make a big difference between days and nights, other than the fact that at night you have less support and less resources around you to help you support these patients. Some nights you're sleepless, some nights you've worked all night and you then need the next day to sleep. And some nights it wasn't that busy, so maybe you got 4 to 5 hours of sleep and it was pretty good. So they can vary, and they also vary depending on specialty and sort of what hospital you're at. Last month I was at the Peter Lougheed for labor and delivery. So busy. It's a very, very busy hospital. And now I'm back at the Rocky View, which is still busy, but less busy compared to the Peter Lougheed. So it sort of just depends where you're going through.
Yeah, another question is like how long does it take to prepare for the MCAT? And like do you recommend any courses or like when should you start? Okay.
I took the summer to prepare for the MCAT. So like in university, you end your like winter semester in April. So by April, you've written all your exams for the winter semester. You have May, June, July, and August off, unless if you're taking spring or summer classes. So I didn't take spring or summer classes. I was still doing research, but I decided to study for the MCAT in May, June, July. And then I wrote it in August because you also want to be able to write it early enough so that you can submit that mark to apply to medical school that sort of that cycle. So I don't know. I took about 3 to 4 months, and everyone takes a different amount of time. Some people are very stressed out during their bachelor's degree, so they like to finish their bachelor's degree and then write the MCAT, and that's totally fine too. Some people like to write it in second year. I wrote mine in third year, I want to say, second or like between second and third year that summer. And I was still doing research at the same time. And yeah, studying for the MCAT is very, very tiring, but remember at the end of the day, it's not worth that much of your score. So it's okay.
Another question is, how do you foster time management skills and efficiency, especially if it's not intuitive for you? In the chat.
Um, Yeah, it's hard. Like even as a doctor, you need to manage your time well, right? We have such busy schedules. For me, it's important to manage my time so that I'm still able to spend time with friends and family, sort of like tune into the hobbies that I'm still interested in doing. That's really, really important to me. I want to be able to take trips with my friends and be able to travel and sort of do all the same things that my friends are doing who are not in medical school, who are not in the medical sort of discipline. And I don't know if I have any specific tips for you per se. Try to do things as early as you can. It's so easy to procrastinate, and I do it too. Everyone does it, so don't worry about that, but just try your best and try to, set reminders for yourself. Usually when you get something done as like at your earliest convenience, then you'll have time to do the rest of your things. Time, whether that's tasks, whether it's watching a movie, reading a book. So yeah, just try to get things done on time. I know that's not really great advice because I can't tell you how exactly you would do that, but yeah, try your best. If it's not intuitive, try setting like checklists and reminders. And I don't know, some people use vision boards, like that works for them. See what works for you.
What do you mean by
Um,
research? Like, what's research? I don't really get what you mean by that.
Yeah. Can I ask what grade or like are you in university?
Oh no, I'm grade 10.
You're in grade 10. So once you're in university, a lot of people will do what's called research. That's when you come up with a research question, like what is the role of, I don't know, what is the role of this specific medication when doing this surgery? Like it's a research question, and you can either be in the lab or you can be, that's called wet research. There's also dry research where you're not in a lab, where you do like interviews and focus groups. That's what my research looked like. I interviewed people and I surveyed people, and I sort of got to know their barriers to health, and that helped us come up with solutions to help people minimize those barriers. My friend, she did research in a genetics lab, and they looked at different genes and they worked with DNA and they modified that DNA using different tools. So all of these different things are research. Research can be vastly different to different people, right? Research in biology is different from research in engineering and research from psychology, but it's essentially just exploring a topic that you like. To do that, you need to find a research supervisor, and that's usually a professor that teaches that topic. And no, your research doesn't have to be medicine related.
Oh,
um,
okay.
okay, yeah, another question was, does joining clubs in university help your application? And did you join any clubs?
Yeah, joining clubs is helpful, but not necessarily just being part of the club, but actually doing something for the club. So, not just being part of UNICEF, but maybe becoming a vice president that does specific roles within UNICEF. That's helpful because it shows some of the skills that you have. Just saying I'm interested in UNICEF itself is not that helpful. I was a part of a few different clubs. So I was an exec on the Bengali Student Society. I'm blanking now, but I was also
Um,
part of Humans of U Calgary, and then there's a few other clubs that I was a part of.
yeah, but mainly like leadership roles, right?
Yes, I was only involved in leadership roles in all the clubs that I was in.
Sarika, I have one question. Though it's almost 50, around 50 minutes already, the session, but one question is,
Yeah.
some students are very confused when they finish their high school. They should go for the life science program or other program, and they're thinking, oh, if I go for engineering, at least I can, after 4 years, I will get the job,
Mhm.
right? But when they're going for life science program, if they don't get the admission first time, second time, third time, so they become a little bit confused and frustration. So what will be your advice in this case? Or sometimes they're very confused. So they should go for, though they want, their family want, parents want, they want to become teacher, but they see the three, four times they try, some did not get the chance.
Yeah.
So in this case, this dilemma, how you are going to give the advice for those families, for the children?
So it's hard, and I get it because I was in your shoes a few years ago, and I was also in high school, and I wondered, if I do biology and I don't get into medical school, then I've wasted 4 years. But that's not true. You haven't wasted 4 years. You're able to take that time and apply it towards a different degree. So you have a few different options. If you want to do other things in healthcare, you can apply to dentistry, you can apply to physiotherapy. You can apply to genetic counseling. You can apply to optometry. But yes, these are all things that require further schooling. It's not like engineering where you're done 4 years and you have a job right away. It's not like that. But I think it's important for you to decide what are you passionate about. If you're passionate about engineering, do engineering by all means. It's a great option and it's a really good career. But I wouldn't do engineering out of the fear that I'm not going to have anything else after my 4 years of biology. Because I think that sets you up, that sort of traps you, right? If you do engineering just because of that, then you might not end up with a great GPA at the end of it because maybe you're not interested in it. If you don't have a great GPA, then you're not going to be able to apply to medical school. So you want to do something where you can achieve a good GPA. At the end of your 4 years of biology, let's say, if you didn't get into medical school, you can also, what lots of people do is apply to a master's at the same time that they're applying to medical school. And that is something that's strengthening your application. So if you have a master's, then medical school looks at that and they go, oh, wow, like this person did more education. Of course, this looks slightly better than someone with just a bachelor's degree. So you're not wasting time, you're just gaining more qualifications while you're waiting to get into medical school. And that's totally okay. So I know it's really, really tough, but I would advise someone against just doing engineering because it's easier than the other option where you have a job right away.
Another question. I just want to make sure you know that you don't have to answer this if you don't, but it's based on the chat. It's asking, is it okay if we ask you what your MCAT and CASPER scores are like, as well as your GPA?
Yes, I can't remember my MCAT score anymore. I'm going to be honest. Calgary Med School only looks at your reading comprehension score for your MCAT. So you need to make sure that you do well on that. I I think each score is I can't remember if it's out of 128 or out of 132. Can someone in the chat tell me if someone has been sort of reading about this? 128, perfect. So each each subject is out of 128 for a total score of 532. Correct me, my Sarah, if I'm wrong. Um, and I think my car's score was around 125, 126. So that was sort of what my car's score looked like. A lot of medical schools are shifting to not need the MCAT anymore. So University of Ottawa doesn't use MCAT scores. University of Alberta just changed their process. So now you need to hit like a minimum score. They might say you need like 124 in every subject. But once you've hit that score, then they don't look at whether you have 126 or 128. So I would just look into the very different requirements that every school has. It's very annoying that it's not like one standardized application. It's a lot of work for you. But if you're able to sort of make an Excel sheet for yourself with all the schools that you want to apply to, all their GPA requirements, all their MCAT requirements, then it'll serve you well. My GPA was not 4.0, it was 3.8 something. So it was close to 4, but not necessarily 4. And after you get into medical school, they actually publish sort of what all your classes GPA looked like, and you're able to see if you were bottom of the pool or top of the pool. And there's GPAs that span along 3.2 to 4.0, but most of them are close to 4.0, closer than they are to 3.2. So you don't need a 4.0, but try to have the highest GPA possible because you can just use all the points that you get.
And then the question in the chat is like, what's the difference between GPA and CGPA?
Yes. And then just to finish off my SARS question, I don't remember my Casper score because when I wrote the Casper, they used to not give us our scores. They do give you your scores now, but they would just send it to the school and not show us. So I assume it went well, alhamdulillah, but I can't tell you what it was exactly. The Casper, generally, if you chat like a normal human being, it's not of concern. And then I'm just looking through the chat. The next question after that was, what was your thought on studying abroad for medical school? I don't really have thoughts around it. Personally, I wanted to stay in Calgary. Like, I wanted to stay near my family, so I wanted to try to do medical school here. I know that when you do medical school abroad, it's very hard to come back to practice here. But that said, it's not impossible. And throughout my residency, I've met lots of people who have practiced medicine outside, whether it's Bangladesh or whether they went, I don't know, to Ireland to do it. They have been able to come back. I just think it makes it a little harder. I think someone just accidentally unmuted themselves. Oh, good.
This other question is like, which easier to get admission at, U of A or U of C?
There's no such thing as which one is easier. They're both sort of equal. It depends on who's applying that year. It depends on who is on the admission committee that year. I'd say both are equally difficult. But U of A is a 4-year medical school. So a lot of people prefer to apply to a 4-year school because you have more time because we're doing the same curriculum, but Calgary's doing it in 3 years and Edmonton is doing it in 4 years. So Edmonton gives you a little more time to breathe. You get your summers off. In Calgary Medical School, you don't have any summers because it's a 3-year program. You breeze through the 3 years without any summers, which can make it pretty difficult. But you're also saving a year, so it's a risk benefit analysis, depends on what you like. And at the end of the day, most people will just apply to both. And then once they have offers, then decide. For me, I have family in Calgary and I'm able to study from home, and that support was important for me. So I decided to stay in Calgary.
And correct me if I'm wrong, I like did a bit of research ahead about like U of A as well, but like around like 80% of spots are reserved for Albertans there, so I feel like it might be easier there, but yeah.
So every school has its in-province quota. So both Calgary and Edmonton, because they're both in Alberta. Yeah, don't worry, Uncle. I'm happy to chat. Thank you. But yeah, because both Calgary and Edmonton are in Alberta, they both have their in-province quotas. So there's a certain number of students that they would take from in-province. And then there's like, I don't know, you did the research, so you know better than me, but like a 20 to 30% of students that they take from out of province. And same goes for every other school. So every school, if you apply to Toronto, then they will also have their quota for Ontario students. And they'll take less students from outside of Ontario, right? They'll also have higher GPA requirements. You can have a 3.2 in Calgary to apply to medical school, but if someone's applying from Toronto, then they need a 3.6 or 3.7 just to apply. So the requirements are different for out of province students. So that makes it easier for you to get in province, but it's not impossible to get in out of province.
Another question from the chat was like, what drew you into medicine? Like, what was the most fulfilling aspect of it?
Yeah, there's so many things that drew me into medicine. Growing up, I was always interested in more so my life sciences classes versus sort of the applied sciences. I liked biology better than I liked physics. I was not very good at physics. I liked biology better than math. I even liked biology better than like English and social. It was the thing that I was drawn to most. I liked being able to do like heart dissections in like grade 10 and grade 11. Like those are things that appealed to me and that I felt like I was stimulated enough when I was studying that topic. Now, another part of me is that I'm someone who is really involved with our immigrant and refugee community in Calgary. And something that I care about is disparities in healthcare that people from this community face. So entering medicine was sort of my way of bridging sort of my interest academically, but also things that I was passionate in, like reducing barriers to immigrant and refugee care. And that's sort of some of the many things, some like two of the many things that drew me into medicine. I like being hands-on, and that's why I picked obstetrics and gynecology because I like being able to do a little bit of surgery and a little bit of medicine instead of doing only surgery. Like in general surgery, you mostly do surgery. Internal medicine, you're mostly doing medicine. Whereas in obstetrics and gynecology, you have a good mix of both, and I enjoyed that. So there's just different things along the way that I learned about myself that allowed me to pick a career in medicine. My dad tried to get me to do engineering. I didn't like engineering. I said, Baba, like, I don't know what you do. Like, this is not for me. And so I stuck to what I wanted to do. If you want to do medicine, you'll have a lot of people tell you a lot of different things along the way, right? They'll tell you it takes too long. They'll tell you, oh, it's not going to work, so don't bother. Like, it doesn't work for anyone, so don't try it. You're going to hear lots of things, but you need to stick to it if that's something you're passionate about. So I think what's most important is figuring out like, am I going to be happy doing something else? And maybe you are, and that's okay. And maybe you're someone who's happy doing multiple things, and that's also okay. Your whole life doesn't have to be about medicine. But if it's something that interests you and you sort of have the perseverance to pursue this career, then I would recommend it for you. But you have to be ready to like hear different things from our community because it's a hard one.
That's like a personal question, but like what inspired you to do research and like do you have any um like resources like that can help like get a research topic?
Can I ask what grade you're in or if you're in
Oh
university?
yeah, I'm in eighth grade.
You're in eighth grade. Okay, so once you go to university, there will be sort of different topics that you learn about depending on the degree that you're in. For me, I saw a flyer that was looking for someone that was interested in immigrant refugee health research. And I was like, hey, that's me. Someone that spoke Bangla. Like, I was like, this is so random. That's also me. And someone with a degree in biology. So I found a poster that was literally screaming at me. And I thought, I need to apply to this position. And that worked for me. If you have, a specific topic of interest, I don't know if you like research about genetics or research about DNA, research about robotics, then you just need to find a professor that does research in that topic and you email them. This is really normal for university students to do over the summer. Just email a bunch of people that have similar research interests and see if they have a position for a research student in their lab. And so that's sort of how you're able to find that.
All right, another question like from the chat is English language or and social important for undergraduate admission of science now? I mean,
I can't remember the admission requirements anymore. English, I believe, is important. Social, I think you can get away with dash
um,
two. I Sorry, did someone have a question?
I don't think so.
Oh, okay. I think you can get away with social 30-2, but don't quote me on that just because it's been a little bit since I've applied to undergrad. But then they take sort of your average of all five subjects that they're asking of you. And yeah, and that's how they determine whether or not you'll sort of get into that degree. So any subject that they require is important for admission.
All right, another question was, how do you deal with difficult people in order to foster the skills you need to address patients and people in emergencies?
Do you mean like difficult patients
Yeah, I'm
or
guessing that's what the
okay.
question is.
Yeah, that's why like communication has to be really, really good. Sometimes, people are really stressed out when they're in emergencies, and that can make them really frustrated. It can make them not be on their best behavior, essentially. Think about you when you're like having an emergency or when you're panicking about something, you're not always, the nicest that you can be. And you'll meet a bunch of different people when you're in medicine. And some will be very nice to you, and some will not be very nice to you. And that's for a whole variety of reasons, whether they're stressed or that can be their baseline. But oftentimes it has to do with just being stressed with the medical scene. Um, I think at the end of the day, you have to remember that you're the healthcare professional. So you need to stay professional despite what your patient population or what your patient is doing that day. Skills that you need to foster is communication skills. Being able to communicate with people during times of emergency is really important. Being able to be patient yourself is really important. And remind yourself of the values that you have, right? Being respectful, being kind. Like, I'm sure those are values that all of you have, and you need to be able to uphold those values even when you're dealing with difficult people. So, I don't know. I think just like reminding yourself who you are at the end of the day is really important as a healthcare professional.
I think that's all the questions. Winnie or Uncle, do you have any questions? I guess not, but thank you so much for spending your time and informing all of us. It's like really helpful.
No worries. I think there's a question we missed
Oh,
in the chat. The difference between GPA and CGPA. Your CGPA is your cumulative GPA. For U of C Med School, what they do essentially is if you finish your bachelor's degree, then they get rid of your worst year. So let's say in first year, you were adjusting to undergrad, so you didn't do very well. Let's say you got a 3.2. And then in your second, third, and fourth year, you got 3.6. Then they'll get rid of that 3.2, and your average will just be out of your last 3 years. So that's really helpful. You'll have to look and see if that's still the requirement today or if that's still what they're doing today. But that's something that you're able to do. And then CGPA is just your cumulative GPA, so your whole GPA without removing that year. And then another question we missed, does anyone know the GPA to get into pharmacy, dentistry, or becoming a family doctor? So to be a family doctor, you still need to go to medical school, and then you apply to residency and you match to family medicine. So the GPA is the same as just getting into medical school, whatever that is that year. So 3.2 to apply, and then the higher you have, the better. GPA to get into pharmacy or dentistry, I don't know personally, but I know those are high GPAs as well, is what I would assume.
Oh, another question was like, you mentioned MCAT contributes 10% towards your final evaluation. Can you say the same about the GPA?
I believe your GPA is 20% of your score.
Yeah, and you
Yeah.
mentioned 50% is your interview and written application as well, right?
So when I say your MCAT is 10% of your score, I mean it's like 10% of your written score.
Uh,
And your GPA is 20% of your written score. Then all of that gets pooled, and now that becomes just 50% of your overall score, and your interview makes up the other 50% of your score. So the interview is worth a whole chunk.
yeah, I think. Are there any
Um,
more do you think I missed?
Wonderful, Dr. Sharika. She has lots of patience. She's a great patience doctor, Alhamdulillah. It is more than 1 hour session. So my request, Saria, so maybe some students join at late. Do you like to sum up in 1 or 2 minutes the students how to take the preparation? Just your whole session, if you like to sum up in 1 or 2 minutes.
Yeah, let me just share that overview slide here. For those of you who joined a little later, this is all recorded, so hopefully you're able to take a look later. But this is essentially an overview of how to become a doctor. You finish your high school, then you have to enter an undergraduate degree. So that's a bachelor's degree. Doesn't matter where you do it. It doesn't matter if you're at Mount Royal versus U of C versus U of A versus, I don't know, Lethbridge. Okay, it doesn't matter where you do your undergraduate degree from, but you need to do a bachelor's. Sometime during your bachelor's or after your bachelor's, you can apply to write the MCAT. The MCAT is a long exam that tests you on 4 different topics. So biology, chemistry, um, reading comprehension, math, physics, and then psychology and sociology. And you write that test sometime at the end of your bachelor's. Then you apply to medical school. Applying to medical school is all of these things together, right? So it's your MCAT, your GPA, checking that you have met the course requirements to apply. It's writing out your top 10 experiences in life. It's research and publications, and then it's 3 references from people who know you very well. people in professional roles. And then if all of that looks good, then you're offered an interview. And if the interview goes well, then you're offered a seat in medical school. Every year, there's 2,000 people that apply to U of C med school, and there's about 150 seats. And then after you've applied to medical school, now you have to do medical school. That's about 3 to 4 years. And then at the end of that 3 to 4 years, you're a doctor. And then now you're doing specialist training as a doctor to become a specific type of doctor. So if all goes well and if all is linear, then after high school, it takes 7 years to become a doctor. But this is what I was talking about, is that it's not always a straight path and you can have different bumps that you hit on the way. And that can make your journey a little longer or shorter, depending on who you are. So that's sort of the overview. If you guys have any questions that pop up after this session, this is my email. So feel free to email me any questions that you have. And I can put it in the chat as well.